Hello all, this is Dr. Shilpi Reddy and today we are going to talk about a very common problem in women that is called as endometriosis. Now what is endometriosis is what everybody has to understand. The lining of the uterus, which is actually present inside the uterus, and that is what sheds during every period. If this lining is present outside the uterus, whether it is on the ovary or in the tube or behind the uterus or any other place like the bowel, the small bowel or the large bowel or any other place in the abdomen, it is called as endometriosis. It can also be present under the skin after having certain surgeries, which is again another place for endometriosis. So why does endometriosis occur is something very difficult to answer. There are several theories to it, but then if this lining of the uterus, which has got a route to go outside the uterus every month, is present anywhere else inside the abdomen, then definitely it has not got any route outside. So it keeps accumulating blood in that area and the area keeps increasing in size. So if it is on the ovary, the endometrioma which is there on the ovary keeps increasing in size with every coming period. It keeps on growing. Sometimes the growth is lesser, sometimes the growth of the cyst or the endometrioma is faster, but eventually it causes lot of pain, lot of painful periods and also intermittent abdominal pain. So these women with endometriosis suffer with lot of pain and also painful periods. Now when we have these endometriomas outside, it also indicates that they will have difficulties in getting pregnant, because whenever the blood collects outside the uterus, it causes a chemical reaction in the body which does not allow pregnancy to happen naturally. So the egg release, the egg traveling into the tube and the pregnancy coming and sticking onto the uterus is hampered. So some degree of deficiency in pregnancy that happens naturally is seen in endometriosis. Now for diagnosing endometriosis, we have a basic ultrasound that we can actually take the help of and locate where the endometriosis is. Once the location of endometriosis through ultrasound happens, it needs a certain amount of expertise to identify the location and also to know the severity of endometriosis by ultrasound. Sometimes an MRI is also done, sometimes CT is also done to look for other areas of endometriosis. And whenever endometriosis is there, if it is a small endometriosis which is not causing much of a problem, you can just leave it aside. But if it is causing pain, if it is causing painful periods, if it is causing irregular periods, if it is causing overbleeding and extended bleeding in your periods, again it has to be tackled, and there has to be some kind of a modality of treatment that we have to approach to treat this form of endometriosis. Usually bigger endometriomas, bigger collections, nodules which are causing painful, not only painful periods, painful defecation, painful intercourse, when the endometrioma is present behind the rectum, in between the motion area and the vaginal area, these cause tremendous amount of pain even during passing motion. At times if it is involving the bladder, that is the urinary tract, it can cause bleeding inside the urine. It can also cause pain during intercourse if it is present somewhere near the vaginal area. That is called rectovaginal endometriosis. So in such conditions, we have to go for some kind of a surgical approach to clear these endometriosis and endometriosis collections wherever they are, in the form of laparoscopy, or if it is very severe and very extensive, sometimes robotic surgery, to clear it completely so that these nodules are cleared of the surrounding normal tissue and then repair has to be done. So when a clear surgical procedure is done, certain medications are used after the surgery also to prevent recurrent endometriosis. Incomplete surgery can give recurrence at an early stage again. And somebody who's planning pregnancy definitely has to go for pregnancy planning immediately after the surgery, after the medical management or the medicine therapy is done. Sometimes people who are going for IVF, they just clearly get the endometriosis out and they get relief of the symptoms, and then in the next cycle go for IVF or the embryo transfer. So these are certain modalities. Definitely there will be change in perceptions, change in treatment, change in guidelines, and change in how you treat it depending on person to person. So it is very, very important that we take every endometriosis care and every endometriotic patient into the loop and give tailor-made treatments so that they will not have these painful and harmful symptoms, and also get relieved of their problems and have happy conceptions in future. And it needs an expert person to do these kind of surgeries, and any incomplete job can get back endometriosis faster. And endometriosis is such a problem that even in expert hand, if you clear it and if you leave it alone, if your lifestyle is not changed, if your eating pattern, if your sleeping pattern, if your stress patterns, and if your exercise patterns are not rectified, if you're not taking your vitamins and medications on time, it can come back. So it not only needs medical treatment, it also needs proper lifestyle changes so that you will not have recurrent endometriosis in your future.